John Jesse with the Health Continuum here with some news for you today. I'm going to die. It gets worse. You're going to die too. We're all going to die. Now that's the bad news, but there is good news, phenomenal news, terrific news. This is it. You and I can have a significant impact on when and how we die. And more importantly, what kind of life we're going to have until then. Now, I'm a lifetime educator, teacher, principal, director of research and evaluation. It was a wonderful, fabulous career. At the same time, I had a parallel path of health nut over the last 40 years. Used my research and measurement and teaching skills to first understand and then to teach and motivate people on how to become more healthy, starting and ending with myself. Now, as an assessment and evaluation expert, I did lots and lots of presentations on data, on how to use it. But my parallel path crossed in, and I began sharing a health tip at the end of meetings, just for fun. I found no one left early. Do you know why? Because everyone is interested in health. I believe everyone really wants to be healthy. I spent the last 40 plus years reading the books about how to be healthy and the research that's cited in those books to back the claims. I became somewhat of an expert of current health theories and research and tried out many of them. It amazed me how many different experts claim to have the solution, the magic bullet for a healthy lifestyle, and yet they were promoting different and even conflicting ideas. It was a massive confusion, and it still is. How is anyone supposed to know what to do when there are so many conflicting opinions and conflicting research constantly being presented and promoted? I decided we needed a paradigm, a framework to organize our understanding and guide our personal decisions about how to improve our health. And that is what I want to share with you today. It is called the Health Continuum. It's a rational way to view, evaluate, and improve your health. It's a simple framework that can help you better make the decisions about what you are able and willing to do to improve your health today. Because everyone wants to be healthy. We just need to know how. On one end of the continuum is death. On the other end is perfect health. We're all somewhere on the continuum, moving to our eventual destination. What we want is not just to prolong the end, but to be able to spend as much time on a place on the continuum where we can enjoy our life and do the things we love with those we love before we finally quickly move to the end. Think of the continuum as a rope with the different factors which impact your health as the strands that make up the rope. The strands I identified are first genetics, can't change that, age, always changing. Response to stress. Everyone must deal with stress in their lives. Your position on this strand is defined more by how you deal with the stresses we face, rather than the aggregate number and size of them in your life. Emotional consumption, which refers to your relationships. The better your relationships, the better your position on this strand, and the better your health. Risk management. Too many risks can result in catastrophe. Too few may result in a lost opportunity and a boring existence. Hygiene. I define hygiene generally as the personal practices and habits that prevent disease and promote health through cleanliness. This would include practices like washing your hands and brushing and flossing your teeth. Significant improvements in American hygiene over the last 200 years or so have been the greatest contributor to a doubling of lifespan over that same time frame. Sleep. Now, sleep research has recently expanded our understanding of how important it is to regularly get adequate sleep, as defined by quantity, how much, and quality, how good. We now better understand the profound consequences, negative consequences associated with sleep issues. Fortunately, I believe you can make lifestyle changes that can address the majority of sleep issues. And next to physical consumption and movement, I would rank this as the most impactful strand that you can improve with lifestyle decisions. Now, the last two, these are the most important ones because not only do they have significant impact on your health, but you have almost complete control over them. Physical consumption. This refers to everything that goes in your mouth, liquids, solids, and everything in between. All of it can have a significant impact on your health. Physical activity. The type, duration, intensity, and frequency of activity determines your place on this most important aspect of the continuum. Now, the strands are independent. You can have a different position for each one, but they are also dependent and interdependent as one impacts and influences the other. They're all interrelated. For instance, a change in physical activity will affect the way you respond to stress, and increased stress may very well have a direct impact on your activity level or your physical consumption. By changing one strand, you change another, and the combined effect can result in either a positive or negative movement along the continuum. But what can I do about it, you ask? Well, that's a great question. This is what you do. You identify the single most impactful change in your behavior that you're able and willing to do right now, and then do it. One strand, one behavior. Most people only have the energy to sustain one change at a time. An incremental change is the kind that sticks and will give you real movement over time. One strand, one behavior. Let's, for example, consumption. Maybe you smoke. Well, I can tell you right now, if you're able and willing to quit, biggest bang for your buck. Maybe you're drinking sugary drinks. That's fake or real. Are you able and willing to give them up or curtail them? Are you willing to eat more vegetables? How about movement? Not moving at all. Are you able and willing to walk for 10 minutes 3 times a week? Well, then you maybe say, well, hold it. I can do both. I can give up drinks and start walking. No. One strand, one change. Pick the one that you're able and willing to do right now that will give you the biggest bang for your buck. Most movement along the continuum. When you don't have to think about doing or not doing it anymore, you're ready to choose another one. So you might say, well, why should I give up this or that or change this habit when I enjoy it so much? And anyway, everything causes cancer and I might get run over by a truck tomorrow. Well, I'd say yes, you might be run over by a truck tomorrow, but I don't think you will. And the real question comes down to this. It's a basic cost analysis. Ask yourself, does this behavior produce a net benefit to you? In other words, is the cost of what you give up or start to do offset by the positive health change it produces? In some cases, the answer will be yes. And in some cases, no, or maybe not sure. It completely depends on your situation and your position on the different health continuum strands. Think about it. One strand, one change today. Hey, be sure to click the follow button right below, and we'll see you again soon. John Jesse with the Health Continuum.